We got too many thorns up here. We need a rose. We need a rose up here. Yeah. Good afternoon. Welcome to SUNY Downstate Health Sciences University. I am Dr. Wayne Riley. I have the honor to serve as president of this great SUNY institution. I particularly want to welcome all of you who are visiting us via live stream. Welcome to Brooklyn via live stream. This is a wonderful day here in Brooklyn. We have the honor of hosting our terrific chancellor, Dr. James Malatros, and he's here to talk about vaccines and the progress that SUNY hospitals have made in vaccinating its essential and frontline workers. Just a few numbers for what we've been able to do. Just today, we will give doses of about 250 doses to 250 of our frontline employees, essential workers who are taking care of patients, et cetera. And since the beginning, since December 15th, we've done over 2,300 vaccinations of either the first stage of Pfizer or the first stage of Moderna. This is also a special day because today we started the second dose of Pfizer. So in other words, those who got it 21 days ago, today is the day when you get your second dose of Pfizer. So this is a doubly exciting day that we're now completing the 2-dose series in the first batch of those employees and staff and faculty who got the Pfizer vaccine in early December, mid-December. Again, I want to salute the outstanding chancellor of the State University of New York. Dr. Malatros has been knee-deep into the planning and work to make this vaccine rollout what we believe here at Downstate Chancellor has been a sterling success. So on behalf of all of your colleagues at SUNY Downstate, again, welcome back and thank you so much for your leadership.
Thank you, President Riley. Just for the record, there's nothing, heroic about what I'm doing. It is about what everyone at Downstate has been doing. It's about the doctors and the nurses and the support staff and everyone else who's come together throughout this crisis. I remember talking to President Riley early into this crisis when I was helping the state out, and I said, we need more help to help Brooklyn. And he stepped up and he said, Downstate will lead the way, and they did, and you did here, and it's a testament to your true belief in helping others. I want to thank Dr. Riley for hosting me today, as well as President and CEO David Berger, Dr. Berger, who has been instrumental, of course, with his entire team. I learned there's a vaccination queen who's here on getting the vaccines going. Today is a great day because it shows SUNY can lead the way when it comes to combating the COVID virus. You saw it when it came to getting our students safely back on our campuses. You saw it in PPE production, and you saw it on the frontline workers in healthcare, downstate, upstate, and our other medical facilities. I'm happy to report that today, Downstate Medical and the first wave of vaccinations has completed 100% of all the vaccines. So they've used every one of their vaccines. Give yourselves a big round of applause. So when some people say you can't do it, Downstate has really been a gem in this system. 100% of the vaccine doses available in the first delivery have been used. That's great. We just got the second delivery this week, and we will continue to vaccinate like you're seeing. As President Riley said, other good news today is we have now started the second dose of the vaccine today, which is really important. So many of the members here are getting their second dose of vaccination, because as we all know, with the COVID vaccination, it takes 2 doses over a course of several weeks, and you see that happening now. What Downstate is doing is nothing short of phenomenal. They are dealing with patients on a day-to-day basis, and they're running a massive operation to vaccinate people. They are doing this 7 days a week, early in the morning till late in the evening. They are making sure that they can get all of their staff. I want to particularly thank their nurses who have been on the front lines and all that they do, and I know that they are coming to get vaccinated, and I have been working with their representatives, and I know that that's a really important thing for us as well, because as we have always said, the nurses are our heartbeat of healthcare, and if we don't have them on the front lines, then there are no hospitals. So I want to thank Downstate for having 100% compliance. Some other data points which I think is important for the entire SUNY system. Right now, Downstate is leading the way with 100% of their vaccinations completed on the first delivery. Upstate Medical, which is our upstate campus, our sister campus in Syracuse, New York, they have currently completed 82% of their first deliveries, which is a big move, and it looks like they'll have that done soon. And at Upstate today, they've started their second shot. So that's an important thing as well. So two of our big anchor institutions, Downstate, 100% second shot, Upstate, 82% second shot today. That is real progress. That is real progress. And then just a couple other more data points. SUNY across the system is standing up. Right now we have a volunteer program underway to help when the vaccinations become more widely distributed to our residents all across the state of New York. We are building a volunteer corps. We have already received 882 students now that will step up who can actually administer a vaccine, help administer a vaccine through the state of New York. SUNY students giving back. 5 of our community colleges this week have signed up to be distribution centers for the vaccine. So once again, standing up and giving back. And an important thing is we've all learned is that this virus keeps throwing us for a curve. It never seems to let up. You have seen this because you were the epicenter of the crisis when it started in the spring. You now see the problem sort of managing itself through the process in upstate New York where you've seen it. Yesterday, the UK strain that everybody's been talking about, which is significantly more contagious, and that virulent strain that we were hoping was not going to make its way to the United States, unfortunately, like in other situations, has made its way to the United States, and they found a case of it in upstate New York. Good news for us, though, is Upstate Medical's saliva test, which is the #1 saliva test in the world, can detect that strain of the virus. So we can manage that crisis at SUNY. So SUNY from soup to nuts. We're vaccinating folks. We're coming up with state-of-the-art testing to make sure we keep our faculty, staff, our students, our residents, and everyone else safe. And this model here, this operation here, should be replicated all across the state, frankly. I witnessed it firsthand. It's easy. It's fully functional. The team deserves a big round of applause. So congratulations for all that you've done, 100% vaccinated. Let's get that second wave done. Thank you.